Welcome to Senior Moment with Nurse Linda on STRN Network, the future of internet radio and TV today, starring Nurse Linda. This is Senior Moment with Nurse Linda. This is Dr. Charles, the man behind the curtain. And this is the healthy, doesn't have flu yet, Nurse Linda.
I took my vaccine. I was a good girl.
Well, I did because my doctor insisted, and that's probably a
Absolutely.
good thing. Everybody's getting flu, enough to affect the economy.
Absolutely. It lost time from work for both the employee as well as the employer. It really impacts everyone, and people don't appreciate that sometimes. As well as people, if you have other underlying illnesses and you get the flu, everything becomes complicated and worse. And we even have young children, young adults dying from it this year. It's really
I
bad.
heard that in the news coming in. 9 more died.
Yes.
Get a flu shot if you find one.
Yeah, at this point, it's getting tough. So if you're going to get it, get going with that.
We're talking about cervical cancer today.
Yes, January is Cervical Cancer Awareness Month. And this is a very important disease to understand. And we're going to be talking, of course, about another vaccine toward the end in the third segment, the HPV vaccine. So we're going to answer, hopefully, some people's questions about that as well.
Which vaccine?
The HPV vaccine.
Oh, the one they want to give kids?
Yes.
Okay.
Yes, and hopefully make people more comfortable with it. But one thing to start with is to understand, if I ask you, the cervix. You probably would know what it is, Dr. Charles, but a lot of people may not. Some people see it as the opening to the uterus, the womb. It is a soft pink piece of tissue. It's got a small opening in the center, and it really acts as the gatekeeper.
Not something you see every day.
Definitely not something you see
Unless
you're a doctor. But it's not completely closed. It's pink in color, and it's covered with flat, thin cells. Then you have the next structure, which is called the endocervix, which is just a little bit deeper into the tissue, and that's covered with a different type of cell. And if people want to win a trivia contest, they're covered with columnar cells. But it's the meeting area of the cervix and the endocervix where most cancers occur. And that's what's important to recognize. People think of cervical cancer as being on the outside, but it's not. It's usually a little deeper in. And that's why when women go and get their screenings done, we're going to talk more about those, then those areas are tested, both the outside and the inner part. And this, believe it or not, this meeting zone is called the transformation zone. It's called the T zone. Almost sounds like a football play. It's the T zone.
22 to 35.
Yeah, exactly. There are two most common types of cervical cancer. One is squamous cell, and that makes up 80 to 90% of all cancers. The other is adenocarcinoma, and that makes up the remaining 10 to 20. This type of cancer develops in the glands that produce mucus in that area, and the incidence is on the rise of adenocarcinoma of the cervix, especially in younger women. Not sure why. There was no information stating what the theory on that might be. But the incidence of cervical cancer in the United States each year is, depending on which source you use, is 12 to 13,000 women in the United States are diagnosed with cervical cancer every single year.
What kind of a test is it? Is it something you should get yearly, monthly, weekly?
We're going to talk a little bit more about that. It's a pap smear. It's a very simple test. It doesn't hurt. Don't care what anybody says. It doesn't hurt. Very simple to do. But what we have on top of that is over 4,000 women will die of cervical cancer.
Because undetected?
Undetected in time. And we're going to repeat this numerous times through this talk, is cervical cancer is one of the most highly curable cancers that are around. If you're going to get a cancer, that's one of them to get, because it is so curable. Even in a slightly later stage, the earlier you get it, the better. But it is possible. It is the second most common type of cancer in the United States amongst women. Okay, I want to clarify that, amongst women. The problem is it develops slowly over time. Your cervical cells don't change very rapidly. So this is a cancer that doesn't present with symptoms immediately. not like a skin cancer where you can see a lung cancer where you might have coughing or blood in your sputum. This has little or no symptoms. It's one of the silent killers because of that. It is preventable. We're going to talk about preventing this type of cancer. Uh, it is one of the most common causes of death amongst African American women. And it is most prevalent in the southern region of the United States, as well as African American and Hispanic women. And it is felt that is because of poor screening. Women don't understand the necessity of the screening and how they have to, what they need to do to prevent this horrible disease. It tends to occur in midlife between the ages of 35 and 55 usually, and this is after being exposed maybe early mid-20s. 20% of these cancers occur over the age of 65, so it's usually recommended that you continue cervical screening to at least age 70, sometimes beyond, depending on your doctor's recommendations. And I do believe that that recommendation is getting older as the population ages. Do you have any questions before I go any further with that?
I'm following you.
Okay, very good. All right. Some of the causes of cervical cancer are, of course, one of the most common things that we always come up with in this show is smoking. One of the big smoking causes almost every single cancer, and I cannot stress that enough. People don't really appreciate that. If you have a decreased immune system, any type of autoimmune diseases, if you have many, many pregnancies, that's another risk factor.
I just look it, I'm not.
Having your first child at a very young age, a family history, and HPV. And we're going to talk a little bit more about HPV in the next segment, and some symptoms and what you can actually do to prevent this horrible disease.
Is this environmental cause as well?
No, it is not environmental.
How long has this cancer been out there, and is it getting worse?
It is not getting worse. It's actually, detection is getting better. And as we live longer, people are surviving longer, so the cancer has a longer time to develop. Where someone maybe wouldn't have gotten a cancer until they were 55, 60 years old, 60 years ago, they would have died by that age. So it's better screening, better treatment, and treating other diseases better. People aren't dying of heart disease. They're not dying of high blood pressure. They're not dying of diabetes. So they're living longer with those diseases, so these other things are developing. So.
That's the plus.
Yes, absolutely.
Okie doke, what do we got now?
Next, we're going to discuss some more causes. I'm going to go into a little bit more about the causes, prevention, and some of the symptoms of the disease, so people can begin to recognize this and get it treated early.
Okay, you can check us out on www.brookhc.com. That's Brook Healthcare, brookhc.com. Phone number is 803-941-7231. That's 803-941-7231. What's our second part again?
Causes, prevention, symptoms, so people can recognize and know what to do.
Sounds like a winner to me.
Yes.
We'll be right back.